Today I wanted to talk a little bit about people with varicose veins and some people who don't have varicose veins but have symptoms of what's known as superficial venous reflux disease. Many people, particularly those in the service industry, those who are on their feet or even at a desk job all day long, have a problem with the veins in the superficial position of their legs, and it allows blood to flow backwards or reflux. And because they're superficial veins, it's called superficial venous reflux disease. Patients may complain simply of restless legs at night. They may complain of aching and tired legs, particularly at the end of a long day. They may complain of throbbing. They may complain of aching pains. And then, of course, they may get visible veins, such as little spider veins or even larger varicose veins. The real issue is that there are normally little flap valves in veins that allow blood to flow up from the feet toward the heart. And when people have perhaps just luck of the draw, perhaps when women who've had children, and people who've been on their feet for long times, for many years, they get backwards flow or reflux, and these symptoms can occur. The good news is that a simple ultrasound in the office will allow us to diagnose whether or not the patient truly has reflux. And probably the patient does, because over 40 million Americans do. The next step after that is not to simply inject small spider veins, but to treat the source of the problem, to close off those backwards flowing or refluxing veins. And that is something that we do in our office. Many people may have heard of using lasers for this purpose, but we typically use a procedure called a radiofrequency ablation. It's been available for over 20 years, and it's been proven to be safer and more effective and less painful than laser therapy. Once we have diagnosed the problem, the second step is close off those veins that are refluxing. The next step is to look at some of the larger veins that may still be present and visible and painful. These varicose veins can then be removed through several small incisions, the technique being called a stab phlebectomy. And some people in layman's terms might call it a series of mini vein strippings. Finally, the last thing that we look at is for those patients that have veins that are spider veins or slightly larger reticular veins, they're unsightly, and they want those treated. Unfortunately, your insurance will consider that to be something that's not covered by insurance. They consider that cosmetic. However, it is very treatable, the costs are reasonable, and again, you don't want to spend your own good hard-earned money on those until you've treated the underlying source, the reflux. But when we approach those, we can often do those with a series of injections in the office using a medication called asclera and a technique called injection sclerotherapy. The littlest of veins, even those in other parts of the body, such as on the face, by the nose, on the chest, and of course on the legs, are often treated with something we call vein go. The people that created vein go are using radiofrequency ablation in a slightly different format in order to treat these tiny little veins. They, of course, chose the name Van Gogh as a play on words like the artist Van Gogh, and indeed it's a bit of an artistry to try to treat patients and give them the ability to feel comfortable with their legs so that they can once again wear shorts or wear their short dresses and their skirts and get back into normal social settings without feeling uncomfortable about those visible and unsightly veins. Should you have an opportunity to take a look at our website at Vegas Valley Vein Institute, I'd be happy to see you in the office.